Vanuatu is one of the most at-risk countries in the world. It is vulnerable to extreme natural disasters every year. These natural disasters significantly affect water sources, food security, infrastructure, livelihoods, and health systems in communities, which often result in the displacement of its people. When these natural disasters strike, what often becomes a secondary priority is women's sexual and reproductive health, or SRH. During and after emergencies, women are most at risk of contracting sexually transmitted infections, unplanned pregnancies, unsafe abortions, maternal death, and sexual and gender-based violence. The Vanuatu Family Health Association and Reproductive, Maternal, Newborn, Child and Adolescent Health Service of the Government of Vanuatu commits to implementing a Minimum Initial Services Package, or MISP policy, to ensure communities have access to life-saving sexual and reproductive health services during this crisis. Vanuatu Family Health Association, member association of the International Planned Parenthood Federation, is a key implementing agency of SRH services in Vanuatu in both stable times and emergencies. Disaster preparedness and having a well-coordinated humanitarian response plan is key to effectively prevent and address these risks. But even with a response plan, response teams still face some challenges. Claude Arukesa, a registered nurse with the Vanuatu Family Health Association, was part of the response team to Pentecost.
When I experience plan there, I'm team leader at time, I'm also one nurse. Life is some challenge na lo network ha. Tamla ko lo PlayStation tawe network inoka. Tika ko lo network iha tumla communicate with them. We humanitarian focal patient we staff for any issues also. Okay, one him second something emi wala distance or location pese mula sta ko lehen. Sometimes ino katrak mula masok pa. Sometimes mula maskarang ulting. Wala kit so emi wala some experiences and mista fesema.
In July 2022, the Vanuatu Family Health Association hosted a 3-day simulation exercise workshop for disaster response. The workshop was facilitated by senior staff of the National Disaster Management Office, or NDMO, in partnership with the International Planned Parenthood Federation. The International Planned Parenthood Federation, or IPPF, is a leading global advocate for sexual and reproductive health. The simulation exercise workshop aimed to identify the roles and responsibilities of SRH response agencies in Vanuatu, share experiences, collectively map out risks, address challenges, and effectively develop a response plan for future responses. Train and build skills to improve responses to sexual and reproductive health during natural disasters, and test systems and processes through simulated exercises.
Pelonaya we simulation ya when by me me first one we Vanuatu Family Health go through. Each staff only come to understand him. What I'm now by me role more responsibility for everyone. Plan the time you miss stop no more. Time we got one emergency, and then you miss stop one them couple respond, pay you no prepare or something. And then you must have about all stakeholders blame me about how you must have work together. Make them say time we got one emergency, pay me no work lo Vanuatu Family Health no more. He me work lo every naravala cluster, lo me go together, lo me work lo save him life.
So this is where the cyclone Miami passed.
Derived from past emergency scenarios and experiences shared by disaster response agencies, the simulation exercise or CIMEX workshop imitated situations faced during natural disasters in Vanuatu.
The level of response is one issue or one topic where hemino continuous. But with this training and all partners where you may come together, simulation hemi protein scope lo work in relation to concern lo SRH, the life lo one beginning or the life one community.
Partnerships are key for disaster risk reduction. Each partner brings essential and unique information to the forefront during the planning phase.
Lo tinting limi emi inputin be mi include mol partner ya. Mol partner inset loading be mi help mi understand am gimi gimi mi understand work mi. Moti mi save yumi tu tai mi kam lo time lo disaster. Then yumi save yumi huna lo bay mi communicate with mal kata.
During the CMEX workshop, disaster response agencies learned how to communicate effectively, respond and execute their action plans when providing humanitarian aid.
Response plan emi part of preparedness. Time you develop a response plan, you want them also you capture them every small things. Plus make them say one complete service you give him.
The International Planned Parenthood Federation provides essential support to its member associations in Vanuatu and the Pacific both before and during disasters.
You can look over there, equipment and the structure itself is gone.
With the ongoing training and resources received, the stakeholders in Vanuatu are now better equipped to provide more effective responses to the people of Vanuatu during a crisis.
In that way, we are sort of advocating for sexual reproductive health, and when they get back to their respective agencies, they do integrate SRH in their plans.
Naya mikim confidence lomi na, mikat confidence lomi wana. Naya ba miko pakai mistarati plo setama pon committee plo mi plo address small issue plo SRH during all disasters.